Today on Ask the Experts, we have our host, Anthony Chang, and feel free to ask questions.
Hi, I'm Emily, and I live in Farmington, Connecticut, and I'm 15 years old.
Thank you. How about Afrina?
Hi, I'm Afrina, and I also live in Farmington, Connecticut, and I'm also 15.
Thank you. Maya?
Hi, I'm Maya. I live in Bexley, Ohio, and I'm 8 years old.
Awesome. Thank you. Nadia, how about you?
Hi, I'm Nadia. I'm 17 and I live in Orange County.
Oh, yes. And so I'll just add to this that Nadia made a great video on kids who have to live with chronic pain and what that's like. And she's excited to expand the video that she did, which was so incredibly awesome, that is available on our website, to make a whole series. So if there's any kids who are listening and you live with pain or chronic pain, Nadia will interview you. So you can put that in the chat and we'll get you connected.
Yes, thank you.
Yeah, that would be awesome. And then do we have anyone else on? I'm having a hard time seeing the list of participants.
Is Diego on, Vince?
Yeah, I'm here.
Oh, there you go. Diego, then introduce yourself.
Okay. Hi, I'm Diego. I live in the Bay Area and I'm 12 years old.
Awesome. All right. So I think it's the 9 of us here. And so what we want to do today is just talk about innovation a little bit. And again, like I said, if you have any other questions for Dr. Chang outside of innovation, that's okay too.
Yeah. So we'll open forum.
Yep.
Although innovation and intelligence are two of my favorite topics. How's everyone coping with what's happening? It's such a difficult time for everybody. So I think all the more reason that it's really good to connect, any way you can. And I have a 5-year-old and now a brand new 7-year-old. She just turned 7. And I tell them all the time, I really feel for them that they are faced with this difficult time. So just say hi. Emma, say hi.
Hi.
As soon as she heard that there's an 8-year-old, her eyes lit up. It's like,
oh, good.
A virtual playmate.
Yay.
Okay. So, yeah, no, it's a difficult time. So, especially motivated to talk to young people during this time. And I also have a summer internship program with young people from 15 and up. So to basically spend the summer with them and talk about many aspects of healthcare, including innovation and artificial intelligence, and most importantly, the human aspects of healthcare. So they come and they're excited to learn about all the new advances, but also just to understand the human elements of healthcare. So,
and iCAN's really excited to work with that program to be able to do some activities in conjunction with iCAN and maybe do something special at our conference this upcoming summer. Hopefully it'll be in France, assuming COVID dies down a little bit or we get a vaccine or treatment. So we're really excited for that, for this kind of opportunity for some of you kids who are a little bit older.
Yeah.
So maybe, why don't you tell us a little bit about what artificial intelligence is? Maybe not all of our kids know exactly what that is or how it could be used in medicine.
Sure. Artificial intelligence was defined actually by, I think best by a computer scientist named Marvin Minsky almost 7 decades ago, who said basically it's a way that machines can do something that would require intelligence by humans. So I like that very simple definition because many people try to define it after that, and I don't think it's the definition as good as the original one. He's literally the first one that defined it, what it is. So it's any kind of machine that's helping humans to do something that requires intelligence. The hard part about that definition is understanding what do you mean by intelligence? Is it a calculator helping you do big calculations, or is it something that is much more sophisticated than that? And that's always up for debate. And some people say intelligence is the ability to make predictions in the future. I kind of like that simple definition too, because not many things can do that. So now artificial intelligence can do that. Yeah. Maybe it's always tough to ask the first question. So maybe we could have someone type in a question in the chat area, or
Yeah,
Ian and Amy, maybe you could ask questions too.
Yeah.
yeah. I was just going to say, for everybody who's on here, if you're having a little trouble with Wi-Fi, feel free to use the chat. Otherwise, you can show off who you are, so you don't have to be on the screen where you stop sharing video if you don't want to. It's however you feel comfortable. But feel free to jump in with any questions to ask our experts on innovation. And if your topic even strays a little bit from that, I think Dr. Ponsky and Dr. Chang would be happy to hear what your thoughts are. So if you have things you've been creating or things that you've been doing, things that you want to know about, feel free to jump right in. Hi, oh, it's so much more fun to see everybody's faces. I'm so glad.
There's a lot of reluctance.
And
All right.
I certainly don't think I'm the expert per se, because I learned one of the reasons I like having a lot of young people
Doctors
in the summer is that I learn a
use
lot
AI in
from
diagnosis
young people.
because of
We
the,
already talked about that
the black box.
last time. I remember I was there.
Hey, Ananya, I think that we can hear your conversation. So you might want to mute. So go ahead, Dr. Chang, with what you're saying.
Okay, I was just saying that I learn a lot every summer from young people. First of all, they teach me really cool words that I need to know to sound young, but also just what's happening in the world from their perspective. And one of the things that we talked about this past summer quite a bit is obviously the pandemic and how does that influence how we think about healthcare. And I was very impressed that the young people said, if anything, it inspired them more to go into healthcare and not intimidate them, even with the risk of being hurt by the pandemic. So that really was tremendous for me to hear, and very inspired by that. So I'm very excited to talk to young people. I just think that they're underestimated as a generation, that's for sure. So unless you spend time with the younger generation, sometimes we don't give them enough credit for being an outstanding generation.
I have my first question that just came into the chat. And
Okay.
so I thought maybe we'd throw this one over to Dr. Ponsky while he's still here, and he can talk about what he's
Sure.
doing, and then you can talk about what you're doing, Dr. Chang. But in your line of work, Dr. Ponsky, how often are you using innovations? And this is from our young person, Afrena.
Well, that's actually a very good question, because in the line of work that I do, which is doing surgery on children, there's very few things available that are made for children. Most things are made for adults. And so every day, we talked about this today when we were rounding on our patients and looking at our patients. We said we have to be much more creative because there are not a lot of inventions out there available to us to treat the children. And then today on rounds, I made everyone stop and I said, let's put our heads together and come up with a creative way of this new problem we have. And one of the nurses on rounds had this incredible, exciting idea. And we're going to do it because it's really hard in our field. There's not a lot there. We have to be very creative. And one more thing is that we needed a way, right when COVID hit, we needed a way for surgeons to help another doctor when they weren't in the same place. And so I called a high school student, and I said, I need something in 3 days. And he made me a digital pointer that I could control with my phone and point with something that was in a different place. He did much better than any of the engineers at my hospital because he was creative and he did it really fast. So this world is exploding with new ideas, and that's the only way we can to really treat the children.
That's awesome. I love that. And I love that the high school kid was able to do it better than anyone else, any adult, right? Yeah, y'all are definitely the creative ones and kind of think outside the box. And, you know, our box is so different than yours. So it's really exciting. What about you, Anthony? How often do you use innovation? How often does that happen with you?
I'm sort of like Todd. Innovation is part of my DNA, so I'm always thinking of new ideas to change something that probably needs to be changed. And it ranges from, like, if I just think back on this week, we had a meeting that was part of the iSpy meeting, so the International Society for Pediatric Innovation. We talked about ideas about how to come back to work safely, define work differently for the future. And yesterday, I'm doing a I'm heading a board review course, and how we're going to do that differently than the traditional review course for anything. So I think it's part of it's like wearing a new lens. Innovation, it's kind of like wearing a new lens, looking at old problems in a way to create more value and change for the better. So I think, and I'm particularly interested in working with young people because as you get older, you find ways to think about failing more and more. And young people are still not having that mindset of being afraid to fail. And I love that. And the young people don't think any idea is a crazy idea. And they haven't been in the world long enough to really be afraid to fail. And I think that's one thing is that maybe perhaps Dr. Ponsky and I have is we're just not afraid to fail. And I think what I even tell my team, because we come up with new ideas all the time with new projects, and I tell my team, if we don't fail at a third of our projects, we're not being adventurous or forward thinking enough. So they really take that to heart, and I'm really grateful that they think that. So I think not being afraid to fail is the biggest asset that young people have, and I see smiling faces around, so they know what I'm talking about. So please don't lose that, or lose that later, but as late as you can in your life, is not be afraid to fail. And that's what stops most adults from being innovative, is that fear of failure.
Yep, I totally agree with you on that. All right, we have another question from Diego, and he asks, what do you think is the coolest thing that you have done for children? And Todd, do you want to take that first since you do have limited time with us? What's the coolest
Yeah, and I'll answer that. And actually, I do have to go, and it's interesting. The procedure we're about to do, we have to be creative with this next procedure. We have to put our heads together, and I invite the whole team because it's not so easy. And we're going to always have to think of a different way. And here's another thing, Anthony, I'm going to add of why young people are better than adults. There's a concept called fixedness. That means that we're stuck in the way that we've seen it done for many, many, many years. And true creation comes when people can think of a new way that's totally different. And we know that younger people are better at thinking different and not having a fixed way of doing things. The most creative thing, my interest is that there's a common problem that children have called a hernia. It's just a common problem. And we came up with a very creative way, my team, of doing that operation with almost no incision, just using a needle. And it was a very creative way of people that collaborated, worked together from China, Japan, and United States and Russia. And together we came up with a way of doing it only with a tiny needle. So that's probably the most creative thing I've seen in my career. And I have to run, but thank you so much for letting me be a part of this. This is very exciting and fun, and I would love to
Thank you.
come back another time.
Thank you
Thanks,
for joining
Todd.
us.
Thank you. All right. Bye-bye.
So Dr. Ponsky has to go back to being a doctor this morning. But he was really nice to join us for a little bit. So, so Anthony, what do you think is the coolest thing you've ever done for kids?
Well, I think of a few things. That's a great question because I haven't really thought about that. I think looking back, probably just creating a special summer experience for young people. That's very different than just about anything else I've seen. So the internship program, for me, it's always about people. And then on the medical side, I co-designed a heart pump with a famous heart surgeon named Dr. Michael DeBakey when I was in Texas. And that was the first time that any kind of heart pump has been used in children. And that's saving lives right now. So I'm very proud of the fact that I took an idea that was in adults to help adult patients and convinced the heart surgeon to redesign it for children. So sometimes the good thing about children is you can get a good adult idea on the medical side and just redesign it for children. And it helps adults too, because what ended up happening was that because we had to design the heart pump to be much smaller for children, and that miniaturization or making it smaller was very helpful for the adult redesign when they went back to do the adult one, because for some equipment in healthcare, it's good to have a very small, as small a size as possible. So in a way, I feel proud that the children's version helped the adult version later, just like the adult version first helped the children's version. So it goes back and forth like that. So I always say that when we innovate, we should, first of all, get the adult innovators involved too, but also that that I always say the smartest person in a room is not as smart as everyone together. So it's always fun to innovate together as well.
Absolutely. I love that. I love that the design helped the adult version later.
Yeah.
That's really great.
Yeah, no, that was fun. I'm a frustrated architect, as you know, since I didn't become an architect, but I think the design thinking that I had even as a kid was very helpful for me throughout my career. It's just always thinking about design and always thinking about, and now that I'm sort of an honorary engineer, having gone back to school for the data science, I do feel like not enough doctors and nurses probably think differently other than the way they were trained or educated. So,
yeah. So we have another question. This one's from Maya. And she asks, what technology do you wish was around? So is there some problem you're thinking of right now that you would love to find a solution for?
Yeah, Leanne will smirk at this because she knows I've been struggling with this, is how to exchange ideas very quickly. Some of you probably have heard of or know about Bill Gates, the famous Microsoft founder. And he said something that really impressed me when I was about 30, 40 years ago. And that was his idea of using computers is that he wanted people to conduct business at the speed of thought. So you think of an idea, then that idea should just go to someone at the speed of thought or thinking, and that's using computers. So I always think that medicine is very far behind and that we should have the speed of thought mindset so that whenever a doctor or nurse has an idea or engineer has an idea, that everyone else should know about it and should appreciate it and work on it together. And that will change healthcare and medicine tremendously. And I think this pandemic has really shown that we don't do that well. I mean, if you think about the pandemic when it first started in Asia and coming over to Europe, and then we knew it was going to land in the US, but it took months before the doctors realized that the sick patients should not all be on the respirator. And that took several months. But doctors must have known about that for the months before that. So it's just a one significant example of how we don't share ideas, fast enough and often enough. So if I could have some pixie dust, that would be one thing I change, is a way to communicate. And now with artificial intelligence and the way computers understand how humans communicate, with something called natural language processing, or NLP, the opportunity is better than ever before that we can do this. So we really need to focus on that.
Very cool. So we have another question from Diego, if I remember. Oh no, Emily. This one's from Emily. What was it like entering into the medical field?
It was tremendously exciting because, as you recall, I said since I was 16, I was interested in being a pediatric heart doctor. So when I went through medical school and training, I had already made up my mind. So it's good and not good. It's good that I was always very excited about being in medicine. Not good in the sense that sometimes I probably wasn't open and minded enough to think about other subspecialties. But nevertheless, it was just, when you know something that's a right fit for you, and I hope all of you will find that someday. It's amazing. It's just like when you study or sacrifice, it doesn't seem like work, or it doesn't seem like it's a sacrifice. It just comes so naturally for you. And that is when I started playing the violin when I was 5 years of age, and I really liked it, but I clearly didn't like it as much as some of my friends that wouldn't mind practicing for 6 to 8 hours a day. For them, it was not practicing. For me, it was it was practicing. It was a lot of work to practice even more than 2 hours a day. But for them, it was just pure love for what they do, and they never minded practicing through the day. And I think that I hope all of you find something that excites you that much, that it doesn't seem like work when you do that particular things. So, and I think all of you will find it. Sometimes I think young people have a tendency to search and get frustrated when they don't find something. And I always say that that sometimes it's just good to pause and sit and let it come to you. Maybe you're trying too hard to find that one thing, but sometimes that one thing will come to you. And the good thing, if you're interested in healthcare, is the good thing about healthcare is there's so many possibilities within healthcare. If you're interested in healthcare, you will find something, the one thing, or two things in my case, or three things that will truly excite you, that you can't wait to go back and read about something or do something fun. So it should be, I think whatever you do in healthcare should be fun. If it's not fun, then it's with the stress and everything, it's easy to feel unhappy in medicine, which is what we're seeing sometimes. So it's good to find something that's fun for you, that it doesn't seem like work.
Yeah, and I'll just add to that a little bit. So, I consider myself in healthcare on the research side of thing and the development of products. But my background is, it's engineering and science and mathematics. So I'm not a blood and guts kind of person. So I definitely would never have been a doctor like Anthony or Todd. But I love being in this world of healthcare innovation. It's really fun for me too. Like Anthony said, I mean, I'm excited all the time for the things that I learn and the things that I do. So just thought I'd add to that. But we have another question. We actually have a few now, which is good. One from Afrina, and she says, how many times do you have to test the innovations before you can actually use them? And how do you use them?
Wow, it's along the theme of asking my team to intentionally try to fail 1/3 of the time. I think even when you think you succeeded, you might fail later. So I try not to use the word failure even in our vocabulary. It's just a rest stop or a pivot before you succeed. So I'm proud that my team actually is really thinking that way. And not everyone is innovative at the very beginning, because it's kind of like a part of your brain that's not awakened until someone comes along and says, maybe you can start thinking differently than most people, which is they're afraid to fail and they don't want to fail. And I think we live in a society that perhaps makes people feel bad when they fail. And for me, failing is just, as Thomas Edison famously said, he didn't fail, 9,999 times. He just found a way to get to success through all of that. So I think if you just have the mindset that they're not really failures, they're just sort of ways you can find out what's working, what's not working, and ultimately you'll succeed. So I think perseverance is really important to success, and also learning to pivot, learning to get around something that is clearly not working. I think we run the risk of something called escalating commitment, which means if it's your idea, you're kind of stuck with, like Dr. Ponsky was saying, being stuck thinking about something a certain way. I think if it's your idea particularly, I think you're less likely to pivot or want to change your idea, even though it's clearly not working. So I think one thing is not to be overcommitted to your idea and keep an open mind when other people make suggestions, and learn to pivot that way. So I think I think you can test your idea or innovation many, many times before you get to success. Occasionally you have something that was such a great idea that it was a no-brainer that it will succeed. And a few people know I ended up adopting kids relatively late in my career. And so I was clearly a rookie dad. And I think that was really helpful to have an innovative mindset when you have young children, and because a lot of situations come up where you have to think creatively. And it was really putting my innovator mind to the test when you have two little girls running around. And I remember in a very comical way, that we had to bathe them, right? So the two girls were very afraid of the tub and being in the water. And I looked on the internet. There was nothing that was, the ideas that were posted ranged from just having like an inch of water in the tub to getting a container and putting them in a container rather than a tub. And none of them I liked, because that makes a mess. So what I did was I realized the girls loved sitting in the laundry basket that I had, and because they kind of adopted that as their sort of little safe place to play, and they were tiny back then, so the two of them had plenty of room in the laundry basket. So what I did was I just put the laundry basket with them in it into the tub when they were ready, and they felt safe at the same time they were in a tub. So for a year or so, they would actually look forward to the tub because they were in the laundry basket and they felt very safe. And I looked online, and no one had done that before. And I thought, well, there might be a business idea there to create something like a vessel or some container that's safe for the kids to play in. At the same time, it had holes in it so you can put it in the tub, and they could bathe and spend lots of time in a tub, and you feel good about it because it's pretty safe for them. Even though you're watching them the whole time, they don't feel threatened and they don't feel nervous about being in the water. So I was glad that I thought a little bit out of the box to come up with that solution. And there's so many instances where I think being a parent, I think being innovative is a good characteristic to have when you're a parent. So, and I see people nodding because they probably know what I'm talking about.
Absolutely. And I'll just add to that a little bit. So talking about, how do you kind of test innovation? It's exactly what Dr. Chang just described, right? He thought about his group that was going to be using the solution that he had to come up with. He thought about his daughters and what they liked. And then he used it with them. He tested it on them to see, is this going to work? And then they loved it. So I think always having the end user in mind is one thing you have to do when you're doing innovation, and to test it with the people that are going to be using it. I think that's really important too.
And not to be afraid to say maybe your idea wasn't as good as you thought it was. If the most important thing is you could think that you had the best idea in the world, but if no one's using it, it's just the best idea in the world that no one uses. So you have to be I think another quality to have is being very humble about your idea, because maybe you think it's a great idea, but if no one else is using it, then perhaps it may not be a bad idea. It's just that maybe people haven't used it. But on the counterbalance, Steve Jobs, who's one of my heroes, said, sometimes you have to create something that no one wants initially because maybe they don't know about that particular product yet. So the iPhone, was created and no one was sure that was going to be a hit because no one really was used to that kind of a phone concept. And he was very persistent, and he was right that people will get to like it. And once they like it, it just kind of exponentially goes up.
Those are really good points, and I love the laundry basket story because I think that illustrates the innovation that all of us do all the time without even thinking about it.
Yeah.
So Nadia has a question, and I think this one kind of goes along with the same theme. This is a great question. How would you harness innovation in wearables or apps to improve healthcare for kids with chronic conditions?
I love that idea coming from Nadia. Thank you, Nadia. Yeah, that's an area that's really exciting for me. As you know, I'm doing anything and everything that has to do with artificial intelligence. And what's exciting to me is the wearable technology, and we're working on a few that will have artificial intelligence built into it. Can you imagine? It will be like a really, really smart device. Not just the device that gives you signals and that your doctors can see or nurses can see, but something that actually will tell you what's going on. So I'm working hard on that as one of my next areas is wearable technology with what they call embedded AI. So the AI, the artificial intelligence, is actually built into the device so that it'll tell you, it's time to call your doctor, rather than the device sending a signal to someone and then you're sitting around waiting for what's happening, and then they call you if they call you. Sometimes the signal and the message doesn't get across, right? So essentially pushing artificial intelligence even away from the hospital, but right to the people with different diseases, especially chronic conditions, and on a daily basis, not just when you're not feeling well, but just tell you on a daily basis how you're doing, based on your heart rate, based on your oxygen level, based on, especially now for COVID. Wouldn't it be wonderful if, and our president unfortunately is now positive, it sounds like things were happening the few days before that he just wasn't thinking of, he was distracted. And that's a human element, right? You're distracted by what's happening in your life. And wouldn't it be wonderful if you had a wearable device with artificial intelligence embedded and would just be telling him, your heart rate on the average is going up 10 or 20 beats per minute today versus yesterday. Your temperature is a little bit elevated. Think about, in this day and age, the first thing you think about is the COVID pandemic. And I think he could have had an early warning system set up so that he would have known earlier. And that affects therapy, as you know, especially in chronic conditions. It's about being preventative and being proactive. So I'm very excited about this decade to come, because I think in the industry, they're already working on different devices with artificial intelligence built in so that it's just smarter. I have a Tesla SUV, and apparently it has like 200 sensors and then, as you know, the signals from my Tesla actually goes into a big computer while the Teslas are sending in signals. And so all the cars under Tesla get smarter because all these signals are going in the same place. And we don't have that for people. So we have it for cars, we don't have it for people. So wouldn't it be wonderful if, young people with your condition have wearable technology and all gets fed into a central computer, and it actually gets smarter and smarter about what to do with certain situations? Because even if you do a wearable device and it has artificial intelligence built in, it needs to get smarter, and that knowledge has to come from everyone sending their signals into to a big computer and getting analyzed. So I think this decade or two coming up is very exciting for healthcare, because I think we're going to tap into all of that amazing advance in technology that we haven't really been. I mean, if you just see how we've dealt with the pandemic, it's really, really a wake-up call for being more modern with technology in healthcare.
Yeah, and I'll add to that too. So my personal area of research prior to getting into pediatrics in general was with wearable technology in the wearable space. And I have to agree. I think that in the future, wearables are going to be everywhere. I think that part of what I worked on was making them easier to wear or something that people would wear, making it maybe smaller or more comfortably. But then adding in that intelligence to it and having all of that data about yourself, 24 hours a day, looking at everything, it's going to give you a lot more information than anybody even remotely looks at now. And I think once we put some intelligence on all that data coming in, we're really going to be able to help take care of people a lot better and a lot easier than we do now. I think it'll be commonplace.
I think the days where you go see a doctor or go to the emergency room only when you're not feeling well should be behind us within a decade. You should just be really on top of what you're doing and how you're doing. So I think it's an incredible opportunity for us to really, really permanently change healthcare in this coming decade. And exciting things are happening in artificial intelligence almost by the week, especially in areas of language, with natural language now, and in the area of wearable technology. I think these are both very, very helpful areas for healthcare.
Yeah, agree.
We have another question in from Nadia, and her question was, which treatment do you believe is most likely to utilize AI in combination with patient data to personalize medicine further?
Well, I think there's so many possibilities. And it's almost, as I said, if you think of innovation and intelligence as, I always say it's like wearing two different lenses, and all of a sudden the problems in healthcare are solvable, so it's like imagination. Maybe that's the third eye, is imagination. You can know a lot about innovation and intelligence, but if you have no imagination, that doesn't help either. So I was asked to give some talks about how I would use AI for COVID-19. I came up with like a dozen things I would do differently. One is for doctors to be able to communicate instantly about what's working and what's not working. So that's a basic thing in terms of making decisions, sharing what they're looking at when they're looking at x-rays. So one exciting area that's already pretty mature now is artificial intelligence being able to interpret chest x-rays and CT scans and be able to come up with the accurate diagnosis, at least 90% of the time. So that was actually helpful during COVID. Well, I don't mean to talk about it like it's a past thing. We're still in the middle of it. But for a while, the chest x-rays people were not sure about the chest x-rays, but now with enough people with this diagnosis now, the software is smart enough to be able to say with 90% certainty, this is a COVID, patient given the chest x-ray. So being able to look at medical images with higher degree of accuracy, being able to share good ideas very much faster. And also, if you think about therapy, which is your question, the three areas that's going to get us out of this pandemic, one is vaccines. So if you think about vaccine development, it's still very, very slow. There's no reason that it should be taking weeks and months. It really should be taking hours and days. So there's some interesting development to use artificial intelligence to better select combinations of different agents to come up with a better vaccine much faster. And also using artificial intelligence to come up with drugs that have already been approved, but just haven't been thought about to use for COVID. And to be able to use artificial intelligence to come up with medications that will be a good match for the disease. So humans usually are not very good at what we call parallel thinking with a lot of data. So we can't deal with all that data at the same time and think very, very in parallel fashion. But computers are well designed for that. So the computers make up for our weaknesses, but computers don't have creativity and insight, which is what computers need from us. So the combination is very helpful for combating over COVID-19. And Google has a really smart unit in their company called Deepmind that has been really pushing artificial intelligence. And they have come up with a way where you can just get the genetic sequence of the virus proteins and instantly come up with the structure of that protein. And that's important because then we can design drugs to basically render the protein inactive. So, because it took humans forever to come up with the structure of the protein, and we're not even sure, but the computer can do it much faster, which means we have a much better shot at synthesizing new drugs that will have an effect on the virus. So coming up with new drugs, repurposing drugs that are already around, and then designing vaccines are the three big areas that AI is very active right now. But so those are the strengths, but the weaknesses of AI right now is, and the weakness is because we don't have the healthcare data well organized and ways of communicating better structured, so that AI is really not as effective as it should be if we just get the data part organized. So in a way, it's sort of the inspiration for us to get better organized in healthcare in general.
Yeah, and I'll add to the answer a little bit too for Nadia. Just talking about where did it go? Yeah, like how is it going to work to personalize medicine further? So I think once we all start wearing these wearables that are become small and ubiquitous, and they're gathering data 24 hours a day, I think what's cool that I think about is that I have all this data about me, but I also have all this data about you and the next person and the next person. And I know my baseline. And so you're going to be able to tailor medicines to me a little bit faster or a little bit easier, or to know exactly what's going on with me. But you'll also start learning what's going to go on with someone else like me, or what's going to go on with someone else who's a little bit different from me. So it's kind of like it's focusing on you, but it's also using you to help understand groups of people like you. And I think that that's really just going to be amazing when we start being able to truly focus medicine on the individual.
Right. Think about the all the Teslas out there with sensors are sending signals and pictures of roads up to a central computer, so that the next Tesla coming down the road, it already knows about a roadblock, for instance, and it didn't know about before. So we have that for cars. Why do we not have that for humans?
Yeah.
So we don't even have it in a primitive form for humans. So again, I think it's an amazing opportunity for especially those of you who are interested in healthcare. I mean, you're going to have, I think, the most fun of any doctor or nurse or healthcare worker in history with everything that's available to you. So I'm a little bit jealous I'm not younger, but hopefully I'll hang around and see what's happening. So
totally agree. Exactly. Good. Do we have any other questions?
I don't know if you have any questions, but I wanted to let everybody know and remind them that they can also raise their hand and just have open conversation. So if you don't want to write something in and you'd rather just talk about it, we have about
good idea.
10, 11 minutes left. And so feel free just to talk. This can be like our coffee hour or cocoa hour where we talk and chat a little bit. And to the point, I guess one other thing, if you have a specific condition that you're thinking about, you can bring that into the conversation too. It's open for anything. So, or if you're an inventor yourself and you want to share your idea, don't be shy. This is a great time to find out what to do for next steps, or maybe, how to continue the research that you're working on independently.
Yeah, I think that's definitely one aspect of healthcare that we don't do enough of, is educating everyone on innovation and what it is, how it can be helpful. What do you do after you have an idea? We're not taught that in medical school or nursing school or other professional schools. And not even engineering schools is that taught. commonly. So I think we need to do a much better job providing education for young people in terms of what do you do after you have an idea. And that's something I try to include in everything I do. If it's teaching about cardiology, if it's teaching about artificial intelligence. And ironically, artificial intelligence doesn't teach about how do you take an idea to reality. So we need to do a much better job educating everyone on that.
And Nadia, do you want to unmute yourself and ask your question? You can go right ahead. There you go.
Sure, thank you. So my question was, is there a limit to what AI can achieve in the medical field, and especially are there things that we'll still need humans for?
Oh, great question. I think right now we're probably a little overly enthusiastic. I think there's something called Amara's law. I don't know, as an engineer, did you ever learn about Amara's law, Leanne? No?
I did
Okay.
not.
Yeah, it's interesting because it basically says that human beings have a very linear, straight line perception of progress, and like with artificial intelligence. So what happens is emotionally, we get excited about it at the beginning, and then we get disappointed later. That's the human aspect of any relationship, human to human relationship or to new technology. So we over-expect things in the sort of period, but we under-expect what it can do later. So that's Amara's law, that with technology, we kind of over-expect things in the first couple of years, but 10 years out, we end up underestimating what it can do. And I think we're in the exact same situation with artificial intelligence. I think we're kind of almost hyping it right now, but I think in a year or two, we're going to realize the reality sets in that maybe it's not as good as it was, thought to be. But I think we need to be patient through that period, sort of the middle period, because 10 years from now, we will be looking back on this talk and you'll play it back when you're in healthcare and you say, I can't believe Dr. Chang was just talking about using AI to look at x-rays. It's like, it'll be like so basic. And then because artificial intelligence will be really part of a lot of different aspects of healthcare by then. It'll help you make decisions, help get information fed in by your patients. You make decisions that are very well informed, but much better informed than now. You will own a lot of your own care because of all the tools that you're going to have. And we're underestimating what it can do 10 years from now. So in 2030, you'll be looking back and say, wow, I can't believe in 2020 we're talking about just reading x-rays with AI or designing drugs with AI, because you would not think that it should be done any other way by 2030. Just like if you think back, sometimes I dig up old commercials just to have a laugh. And Leah might remember this when I was giving a keynote one time on innovation. I just looked back on, I think it was back in the 1990s. When you look at the commercials back then, imagining the future, and the imagining the future was, can you imagine driving across the country with no maps, no paper maps? And you're all too young to remember that your parents probably had to go to the AAA store or the gas station if they want to go anywhere and get the appropriate paper maps or books of maps. There was no such thing as GPS back then. And the advertisement was saying, can you imagine driving across the country with no paper maps? And people back then were thinking, that's crazy. How can you not have maps when you drive across the country? And now we take it for granted we have GPS. It's not 100% right, but it's 99.9% right. So, and even accommodates traffic patterns, right? So we take it for granted in a way. I mean, imagine a world before search engine from Google, where you actually have to go to the library and look up information. That's all within my lifetime and some of our lifetimes. So things are almost, in some aspects, too easy that you take it for granted. So we're going to be doing the same with artificial intelligence in the future, that we're going to look back and say, I can't believe we were just thinking that it could just read x-rays. It's like, we can't function without it. I think that's going to happen in medicine. So again, Amara's law is we overestimate in the beginning, and then we underestimate in the long term.
And I'll add to this discussion a little bit. So one of the parts of your question was, are we still going to need humans? And I'm going to say absolutely.
Yeah.
I think that while artificial intelligence is going to be able to do so many things for us and probably be smarter than us in some ways, make it easier to do some things, I think there's always a human element involved. Yeah. You have to understand the patient and the problem, and you have to really listen to them. And I think the human brain is really remarkable at synthesizing some information, but also being empathetic and understanding what your patient is going through. That I think 100% there's always going to be the human involved. And really, even with COVID, one of the things that a lot of you told us when in another meeting we were having is that you really preferred to meet with your doctor in person instead of just doing it online.
Yeah.
And I think that kind of shows that where that human element is really necessary in making you feel good about what's going on and making you feel like you're being heard and being listened to.
Yeah, I think you're going to see that humans really have a partnership with machines in the future more and more. Yeah. Just like you have your iPhone with you all the time, you can have artificial intelligence with you enough so that your life is going to be easier. So, but we're going to go through a transition period that's going to be disappointing a lot of people. You're not going to get that, and we need to have the patience to see it through, because it is an amazing resource, especially once you start understanding it and know about it. And you just say, wow, if only we could have this in medicine, and that means the resource isn't the problem. It's how we apply it and execute it is the issue that we need to overcome. But I think, again, in the future, you're going to say it's amazing how in 2020 we're thinking such basic things. And if you think about the progress it's made already, right? I mean, no one would ever think that, or very few people would ever think that Amazon knowing what you bought in the past and make recommendations to you is really machine learning or artificial intelligence. So, but we don't say, oh, it's artificial intelligence helping Amazon pick these things. You just say, okay, it's picking things I like, or movies that on Netflix picking movies I like. It's really driven by artificial intelligence, but no one talks about it like it's artificial intelligence because it's just part of the expectation now that we have those things. So, but occasionally it goes pretty crazy, right? I mean, I wrote a book on heart failure in children about a decade and a half ago, and I'm always curious to see how it's doing, and because it's out of print, right? So occasionally I'll even take a screenshot because it'll say, okay, this book is available, and it's like $9,000. It was being sold at like $120. So it's just like, it lacks common sense, right? It's driven on algorithms. So as long as there are buyers and there are not enough copies, the price is going to keep going up. And you see this thing, you see this phenomenon on Amazon often, because if you look for something and it's just not that many copies of, but a lot of people want it, you'll see astronomical prices like bed sheets. I was looking at bed sheets. There's some bed sheets that are like over $10,000. Just because a lot of people want that brand, and that brand doesn't have enough supply available. So it'll just keep driving the price without any common sense to levels that no one would ever pay for at that price. But the computer doesn't know. It needs what I call cognition, or a human mind, to say, this is crazy. You got to stop doing this. And so it's nice that we have a partnership between humans and machines, because humans have common sense. And that sometimes is actually, what's easy for humans is actually sometimes very difficult for computers and for machines. If you think about how the little kid plays, it's very hard for robots to play like a kid. It's just like it's very hard for machines to have common sense, something that's so easy for us, right? So, and we see it all the time. Amazon does this all the time. It just, it has to find a way to have some common sense. And maybe that common sense is actually my suspicion is that not enough humans are actually looking at what makes sense and what doesn't make sense. It's just a massive, display of algorithms. So that's why things don't make sense. No one ever paid $10,000 for bed sheets that are just average. but it's because the demand is so high. So there needs to be what I call humans in the loop of everything that we do in artificial intelligence.
Yeah.
Well, risking us not going over, but I want to get this last question in. So if you have any answers to this, this is from Monika, and she wrote, do you plan any innovation on congenital anemias treatment? Is there any project instead of getting blood transfusion or getting it shortly? So I think she wants to take that process down a little bit. If you have any ideas on that, that'd be great. And then we will be wrapping up.
Wow, the hour went by quickly. Yeah, I would love to take on all of these issues. I'm not a hematologist who will be focused on this issue, but you're so right. In 2020, sometimes we have to step back and say, getting transfusions from blood from another human being, that's been around for hundreds of years, or at least 100 years. Why are we still doing that? Putting an IV in, why are we still doing that? Drawing blood to get tested, why are we still doing that? So I'm counting on you young people to say, stop the madness. We got to think about another way of doing this other than transfusions, right? So I absolutely agree that we need some innovations in that area, and we need to think about it together. And that's why we have this organization called iSpy, or International Society for Pediatric Innovation, so we can have all the great minds together in the same room, rather than one person in isolated fashion. We're all thinking about this problem. And one of the things that we have to overcome is that congenital anemia, like you mentioned, is relatively uncommon in children. So these relatively uncommon conditions really don't get the attention from the medical field as they should be. So the only way we can do this is to band together and think about these problems, relatively rare problems together, then we can solve them. So I don't have a solution for congenital anemia and how we can transfuse, but perhaps sometimes have out-of-the-box thinking about maybe what would you do if you don't use transfusion as a treatment? I think then that starts the thinking process, because if we always say transfusion is the conventional therapy, and we don't say to ourselves, what would you do if transfusion was not available all of a sudden? Just like when we went through the pandemic, what would you do if you can't see your patients in person? Well, telemedicine's been around for several decades, but we just didn't activate it. In our hospital, we went from a projected 500 experiences in a month to, I think, close to 15 or 20,000 in a month, because we were forced into that situation. Just like I was telling our team, the best solution to not fax anymore is to just get rid of the fax machine. Humans are great. You will find a way to get the same thing done. But as long as you have the fax machine, you're going to fax, because it's a comfort zone. You're comfortable faxing. So I think perhaps the solution to that transfusion as a therapy is just have doctors and nurses say to themselves, what would you do if you cannot transfuse? How would you treat this? Maybe it's a new medication that no one's thinking of. Maybe it's just a new way of treating this condition without blood. Maybe it doesn't need to be blood per se. So there are many, many ways I think we should look at that problem. And the issue we face is that there are not enough people with this condition. But in the future, hopefully, if everyone can have thoughts together, then hopefully enough people around the world will be facing or coming up with solutions to this problem that we can solve them. These are amazing questions. I think Dr. Ponce and I are, we're not surprised that the best questions come from young people, but I think we're always happy to be there for you. And we learn a lot too, getting these questions from young people, and inspires us to keep working hard on having organizations like iCAN and iSpy to provide inspiration and innovation for young people.
Yeah, and I just want to say I'm so happy that we had so many of you on the call and that you wanted to interact and ask questions. That's exactly what these sessions are meant for. This is going to be a monthly thing, so please feel free to join us every month to talk to Anthony. and we're going to have special guests on sometimes, just like Todd was today. And I think that this could be a really cool thing. I think our next one is, what's the date of our next one, Amy? Do you remember? It's going to be careers in medicine is going to be the main topic. But again, like today, you can really ask on any question that you want.
The next one is also in the chat. So if you want to take a quick screenshot, it'll be on November 7th at 10 a.m. Eastern time, same as today. And you can register and sign up at icanresearch.org/events. And we will do the same thing. We'll put the information to reach the meeting into the notes. So you'll be able to sign up and get all your information right there and start thinking about your questions. You know, come prepared to talk. And this was great. Everybody today did such a wonderful job, and we're so appreciative.
Yeah, I think anything with young people is going to be great. I'm never disappointed.
Yeah,
and I think it might even be good to get both the iCAN and iSpy international centers involved. How cool would it be to get questions from around the world? And now that we're virtual most of the time, it's actually very, very easy to do. We haven't been able to do that before, but now, you know, getting a virtual presence from India or Italy is no longer a big deal. Other eyes, I don't know why I'm stuck on I words, but but it'll be so amazing. And I go through many meetings, and it's just amazing to just have someone from Italy or India just pop up on the screen. And it's always good to think from a very bad situation. So
yeah, and I'll say then, to that point of having people around the world. So it's 10 a.m. Eastern time, which will be different for your country if you are in Albania or Italy or somewhere else.
Yeah, they'll be in the afternoon times, but it's very doable. So
yeah,
I'm willing to get up at 2 a.m. if I have to for this. So
I love that. We really, really appreciate your time, Anthony, and your dedication to working with young kids and youth and helping them in all sorts of ways. You know, this is all about really answering questions and kind of taking down those barriers between kids and doctors and other professionals in the world, and understanding that, you know, that meaningful conversation is really important, and it does help both directions. Both sides are experts in their own way. So we appreciate your time.
Well, the young people inspire people like Dr. Ponsky and I, and I'm sure Leanne too, and Amy. You're why we do what we do. So please feel free to reach out, and we're here for you always.
Yeah, I was going to say we have a couple international guests on here right now. Ornella, do you want to say where you're from? I don't think you got to do the introduction earlier today. You can unmute yourself. And if you can't, I might be able to do it for you. Let me see. Nope, I think you need to do it. If you hit the little icon down below with the microphone, you can click on that. It should take you out.
You may not want to talk. You may be shy, which is fine. But I think Albania is correct, isn't it?
I think so.
Yeah.
And Monica, did you want to say where you're from? Might be a little shy. That's okay. But we do have.
There we go.
Oh, here we go.
Hello, everybody.
Hi, Monica.
Hi.
Me and Ornella are from Albania, and we thank you very much for this conversation. I am a doctor, and I wrote to Dr. Chang that I take care of patients with thalassemia. That's why I'm very worried about their health and treatment. And thank you a lot.
We're so glad you could join today.
Thank you, Monica, for that question, and welcome. It's great that our first meeting already has an international audience. We can brag about that. You just made us international, Monica. So yeah, I actually do take care of quite a few children. She might be saying, well, why are cardiologists taking care of children with anemia? Because they sometimes have heart failure. So and I also try to, well, here's a good example of being innovative. Not a problem with so much with young people with thalassemia, but I see a lot of children with sickle cell disease.
Yes, the same to us, yes.
Yeah, and as you know, they often have pain crises.
Yeah.
And I've, again, this is about just having a lens of innovation with you all the time and looking at problems all the time. And I'm just I love being a problem solver. So I follow a lot of patients with sickle cell disease because, as you know, they can have iron in their heart from transfusions.
Yeah.
And I have to make sure they don't go into heart failure. And then in talking to these families, I realized that I've always realized it's hard on the families, but I think when you can relate to the families and having to take their kids into the hospital all the time for pain crises, I kept thinking about what I can do to come up with something. And I realized that a pain crisis is basically sickle cells getting caught in the capillaries.
Yeah.
And I prescribe vasodilators all the time on a daily basis. So I said, and I looked in the literature, there was no mention of using a vasodilator like an ACE inhibitor to treat pain crisis. And I said, well, I explained to the parents that this hasn't been done, if they'd be willing to try. I could rationalize using this for the heart anyway, because the heart is very big, as you know, in anemia.
Yeah.
And let's just see if it makes a difference. And to my amazement, for some of the children, it was like night and day. It actually prevented them from going to the hospital, ever again for a pain crisis. Now, so that's a positive experience in some patients, not in all patients. So unfortunately, it's hard to get that information out there. And so many children go on crises now. And one of my patients got to see a doctor at another center, and that the hematologist said they had never heard of it. And I just think it's very unfortunate because children continue to have pain crises, and yet some of them can be helped with a vasodilator. And I was just using it just to try and see if it worked. And to my amazement, it actually worked in more children than I expected. So I think it's an example of how if you just are willing to try something to make a difference and have a positive benefit, then why not? Just because it hasn't been done before, it doesn't mean that it hasn't worked. So, but I think the anemia issue we should think about, because there's no reason why children should get, routine transfusions in 2020. We need to come up with the technology and the know-how to solve that problem.
Yeah. Thank you for sharing this experience, because at the same time I follow up patients, children with sickle cell disease, and it was very worth it to me. Thank you.
You're welcome. Great to hear from Albania on a Saturday morning here. So.
Too far away.
Yeah, I know. We're super excited though.
Yeah.
Well, in a way, being virtual solves the distance problem. So I think normally a pediatric cardiologist in Orange County, California, probably wouldn't be talking to a hematologist from Albania on a Saturday, but now we can. Now we can. So
yeah. Fantastic. Thank you.
Thank you.
Thank you, everyone. This has been really great and exceeded my expectations for the first one of these. So I'm super excited now to have this happen every month. Tell your friends to join or join us again, certainly, and we can continue the conversation with Dr. Chang.
Great. And we'll have as many guests as possible.
Absolutely.
Right? Yep. Invite everybody you know. Feel free to bring a friend next time. This will be a great session for everyone. And go out and enjoy the rest of your weekend. Have a great day.
Yeah.
Bye.
Bye, everybody.
Bye. Thank you.
Bye.